Part 3, Clinic of Hope. The rising incidence of PJIs is anticipated to increase due to higher rates of obesity, diabetes, and immunosuppression. Despite new strategies to prevent and treat, such infections continue to be a huge burden for patients, providers, and their institutions. In Part 3, we'll discuss the establishment of a multidisciplinary practice to prevent and treat PJIs. We are speaking with Dr. Jessica Seidelman and Dr. William Juronic. Both work at the Duke University School of Medicine in Durham, North Carolina. Dr. Juronic and Dr. Seidelman, please tell me about the Clinic of Hope. Dr. Juronic, please go first.
I'll lead off because I think it was my, I'm responsible. Perhaps I shouldn't have, but Dr. Torsten Seiler, and one of my partners who also does a lot of PJI work, and I were sitting in clinic trying to one-up each other on who had managed the most difficult infection that day. And I kind of tongue-in-cheek said, "This is the Clinic of Hope." But I think it's actually quite accurate. Most of the people that come with a prosthetic joint infection are depressed. This is the worst thing that could possibly happen. A lot of them have had multiple unsuccessful surgeries, and they are truly looking for somebody to give them hope. Yes, this can be managed. Yes, we have a strategy for this. And that's how it started. And I think we said that we're not going to be successful unless we have a collaboration with our infectious disease colleagues. And that's how we decided, let us experiment with a clinic that includes both the orthopedic surgeon and the infectious disease specialist. And that continues. We continue to try and explore the best way to do that. I think Dr. Seidelman will tell you it's we're continuing to evolve. But I think for the patients, for the 1% to 2% of people who are afflicted with an infection, it's an incredibly traumatic thing for them, and to have some place that's specializing in it, I think, does give them some hope. And so we're trying to build on that. And the real concept is, as you've said before, multidisciplinary. I have a lot of preconceptions that come from the orthopedic side. Dr. Seidelman has a lot from the ID side. Neither of us are completely right, and it's good that we share our impressions and our experience. I think that makes a better product.
So can you give us a brief overview of some of the prevention measures that you're using at the Clinic of Hope?
Sure. So we'll often see somebody with a chronic prosthetic joint infection who is also overweight, whose hemoglobin A1C, their glycemic index, is markedly elevated, who is on, say, for example, they have untreated lymphedema. These are all conditions that we should be treating on the front end, not the back end. I think there was in the past this tendency, you've got a red hot joint, you need to get to the OR immediately and get it managed. And that probably started some of the less than optimal management techniques that we did. I think there's now a consensus amongst most orthopedic surgeons that identifying the bacteria is very important, and then optimizing the patient who gets referred in and is sitting in the emergency room, febrile, and with a high glucose, that we may be better off awaiting cultures and managing their medical problems before we treat the PJI. Whether it's acute or chronic. I think we have the luxury of 1 to 2 days to get things figured out and to optimize the patient. I think that most PJI surgeries shouldn't be done on Sunday night by a person who's on call and has been managing orthopedic trauma all weekend. So these are the things that I think we've learned painfully by experience. And I think the message to the treating physician is it's not a surgical emergency in most cases. So make sure we're taking good care of the patient, we're optimizing them, because the morbidity associated with any surgery for PJI is significant. And particularly if patients have had multiple surgeries. I think there's this tendency to say, well, we'll just wash it out and then we can come back another day. And the morbidity of opening up a joint and washing it out is significant. And if we don't treat it completely, the cumulative effect may be negative for the patient. So I think the message is identify what you're doing, do it in the best possible way you can, and trying to do it in the fewest number of surgeries as you can.
Dr. Seidelman, do you have any data that points to the effectiveness of this multidisciplinary approach?
That's a really good question, Jane. We've been utilizing variations of this clinic model probably since July of 2020. And I think the real challenge has been, how do we prove its efficacy in numbers that make sense to folks in our C-suite, right? We've published our experience on our combined ortho ID clinic for PJIs, and we've shown that in these studies, we've improved care coordination, patient outcomes, educational value. So at Duke Health, our clinic model resulted in a no-show rate of 5%, which is actually really, really great. I mean, if you look at other clinics, the no-show rate is much higher. But what we found is that, if you say you are coming to the same, you're coming at this for the same time, same room, and you get 2 doctors in the room at the same time, it really facilitates multidisciplinary decision making. And I think patients are really reassured by the fact that, for instance, Bill and I are in the room together. We are having this active conversation in front of the patients, and they feel reassured that, okay, my physicians are on the same page, as opposed to me saying, oh, well, I think you should have this surgery, but I'm going to have to talk to the surgeon. Or Bill saying, well, I think this is the antibiotic plan, but I have to talk to ID. It just really creates a lot more, I think, confidence in patients. And then the other thing I'll say is, we offer kind of individualized, guideline-driven care for really challenging patients. And, it's one of these things where does the name Clinic of Hope come from? It comes from the fact that so many of these patients have been turned away, and they're coming to us because we are offering them options. We're offering them hope. And again, when we did a study on all of our arthroplasty fellows, so not only did we have Bill and I, or ID Ortho, we actually included folks that were doing arthroplasty fellowship for a long period of time. And 85% of those fellows felt that this multidisciplinary clinic model really prepared them for PJI management in their clinical practice. And 93% recommended this experience for future trainees. And, it wasn't a lot of clinic. It was a half-day model a week, but they really felt like they got a really good experience in that clinic in and of itself. So I really think, and there's also a review in the New England Journal of Medicine that further supports the consensus that specialized high-volume centers, coordinated ortho and ID teams are recommended for PJI management because the approach enables meticulous surgical and antimicrobial planning, optimizes functional outcomes, and is really analogous to multidisciplinary care that we see in oncology. So I think in summary, all this to say The medical literature demonstrates that combined clinics improve operational efficiency, patient outcomes, trainee preparedness. And I think the one piece that I really want to work on is the dollar sign amount, because again, going back to kind of what we talked about in the first part, if we can show that we're actually, saving money in terms of readmissions, additional complications, I think that'll make this that much more of a riveting argument to have these clinics.
Alrighty, thank you so much for that information. This ends part 3. In our next section, Dr. Seidelman and Dr. Juronic will present a high-risk patient. To obtain credit for this program, please listen to the video in full and click the button below the video for CME/CE evaluation. Fill in your information on the evaluation page and answer the questions. Upon submission of your evaluation, an email will be sent with your certificate to the email address you provided. If you do not receive your email certificate within a few minutes, please check your junk or spam folders for an email from info@medavera.com.